Hey, this is Art, and I would like to welcome you to another episode of Cop Medics. I'm sure anyone who has been a medic knows the importance of good report writing. This presentation is not going to be on how to write a good PCR. This presentation is going to discuss what I have used for documenting patient care during tactical and remote operations. When I started operating as a SWAT medic about 20 years ago, the electronic PCRs were just being introduced to the EMS agencies in New York State. About 12 years ago, I found that none of the state's EMS agencies used paper PCRs anymore. Well, since money for medical equipment was always tough to get, I knew I would have a very hard time to justify my department purchasing an ePCR system, especially since my team only did about 2 to 3 PCRs a month. So my only option was to continue using the paper PCR. This specific version of a paper PCR is what my team used to use. And for those of you who have worked in tactical and remote environments like myself, may have found this specific version was not that user-friendly. Certain things like disposition codes that did not pertain to my team's operations, such as we were not going to be going to nursing homes and we were not going to be dropping patients off at their homes, just wasn't going to happen. There was also nothing in this form that would point out that we were working in a hazardous or unsecure setting, and I will discuss the importance of that option for the next slide. So after a few years of using the paper PCR, I felt my team needed a better option for documenting patient treatment. So this is what we came up with: a Word document PCR that was designed to fit the needs of my team. How we started designing this was taking parts of the older style PCR we used to use and formatting it a little bit like my team's incident report forms. And thanks to some department secretaries who were masters at WordPerfect documents, they helped design this form so you can use the option to click the box with a mouse key for certain portions of the document. This PCR format matched up with our team's operations, such as type of incidents. We can let the reader know if we're conducting a tactical operation, overland search mission, or a helicopter hoist rescue. We can also put down if we were working in an unsecure/hazardous settings while providing medical care. This will help explain why we might not have been able to conduct a full patient assessment, or why I could not have taken a full set of vital signs, which is something I've had to do before. We also modified the patient disposition codes, such as number 001, which stated patient was treated but not transported to the hospital. That was for law enforcement members only, so we can document that if there was a minor injury during an operation, but the operator stayed in play until the operation was complete. This way, he or she had an easier time documenting an on-duty injury. We did not have the disposition code for refusing medical care. It was our team's SOPs that if we provided medical care to any civilian, we would immediately call for an ambulance, regardless if the patient said they did not want to go to the hospital. Since we were a non-transporting EMS agency, we would always request traditional EMS providers show up to provide further pre-hospital medical evaluations and transport options. That policy always worked out well for us, so no one ever accused us for denying medical care. So getting this PCR format approved was a little tricky. First, like all good soldiers, I had to go through my chain of command to get this PCR approved. And at that time, I had 5 levels of supervision in my chain of command. So after I got the approval, I had to get the go-ahead through my team's medical director, who was always very supportive to our needs. And he gave me the go-ahead right away. After that, myself and one of the other paramedics in the department met with a representative from the New York State Department of Health to get get the okay from the DOH to use this style PCR. I can't remember the rep's name, but he was pretty cool. He knew our team got put into a lot of high-risk situations, so he gave us the approval after a quick 10-minute meeting. After getting this PCR approved, it was not only submitted to the other medics on our team to use, but to the troopers in the state police who were also acting as medics. This new format made documenting patient care a lot easier for us, and I have been very happy with the results. So the PCR I showed in the last slide was great for writing patient care reports at our headquarters building, but not so much in the field. So I decided to make up these patient treatment cards. I'm sure many of you have seen or used military-style TCCC patient treatment cards before, and I did consider using them, but those cards had treatment listed on them, such as narcotics for pain management and administering blood products, which were things that were way out of my team's scope of practice. So I had these cards made up. They weren't hard to format. I just looked at a few military-style patient treatment cards and changed the format to mirror our team's medical operational abilities. After saving this format on a Word document, I took it to a local print shop and had them print about 200 cards onto thick stock paper. This worked out great to documenting patient care in the field. Now, there were times when I worked in a remote environment, I was not able to directly hand off the patient to the transporting medics because the patient was being extricated by a helicopter hoist. So what I would do was take pictures of both the front and back of the treatment card on my work phone and leave it with a patient. This way, when I got back to a computer at my headquarters, I would still have all the information on my phone of the patient. I was very happy at how these cards worked out and when it came to patient documentation. And I also used one of these Write in the Rain books to fit my cards in. To summarize, I know anyone who has been a medic for a while knows how important documentation of medical care is. I can say, as someone who has had to testify in court for critical events, there was never a lawyer who was able to criticize my actions since I properly documented all my patient care. Well, I hope you found this informative. Please let me know if you have any questions or comments. If you want a Word document copy of the treatment cards or PCR, you can email me directly at copmedics@gmail.com. Thank you and have a great day.